Charles, this pandemic finds the health sector in a very unfortunate state where doctors are unhappy, our infrastructure is not up to standard, nurses are unhappy, they're threatening to down tools. What message do you have for the doctors and the nurses, these people that we value so much, particularly during this difficult time?
Yes, you know what? It's the COVID thing is actually terrible. It's terrible for the whole world, but in some ways it has brought to light the situation that is obtaining in most of these institutions in Zimbabwe. As you know, Zimbabwe has got a very good infrastructure. The system was designed such that all Zimbabweans, whether they're in a rural setting, district, provincial, have got access to health services. We've got facilities that have been there since, independence. But unfortunately, over the years, these facilities have deteriorated tremendously. The state of our institutions is not good at all. We all know that. So that's a big challenge, that's a big challenge. And then, of course, the people that work in there, particularly the junior doctors and the nurses, these are the frontline people. These are our foot soldiers. These are the people that when you present to the hospital in the middle of the night, you're not going to be seen by a specialist or a consultant. You say a junior doctor and a nurse, they attend to you. So obviously the welfare of people like that is very, very important. There are certain minimum standards that are acceptable. The salary has to be commensurate. Where they live, the transportation, all those are basic needs that I think the powers that be have to address. I was a junior doctor myself. I went through the system. The situation that we had when I was a junior doctor and the situation that these young doctors are going through now is so different. It's actually very, very sad. All I can say is that the senior doctors sympathize with the junior doctors. And I'm sure you've seen them come out in the open to say that, the conditions that these junior doctors are having to put up with are not really acceptable. So, we really sympathize with them, but obviously the powers that be are the ones that need to attend to these issues and urgently as well.